Cedars Sinai is one of the largest deliverers of healthcare on the West Coast. We run a large primary care network, and at the same time, we also deliver the most complex, complicated quaternary and tertiary services, programs that really require the highest medical skill and talents in the nation.
Cedars Sinai has gone through a tremendous transformation. We went from a high-quality, community-based hospital to an academic powerhouse.
One of the great advantages we have, of course, is living in one of the most wonderful and diverse cities in the country, and it doesn't hurt that the climate isn't too bad either. We are blessed by a great environment, intellectually as well as personally, and that allows us to have the very brightest trainees who make our chances for continuing to push things forward and innovate even greater.
We're dealing with world-class vascular surgeons in a world-class institution in one of the most desirable places to live in the country.
We cover the entire spectrum of both open and endovascular procedures, and I think our graduates are well qualified to independently practice the full spectrum of vascular care.
There's a lot of different vascular surgery running the spectrum, to the extent that in the first 6 months of fellowship, our first fellow had met a lot of his requirements for the entire 2-year program.
There's many different people involved in the training, all of whom were themselves diversely trained. So there's not sort of a standardized way that we treat patients, which I think is important in vascular surgery in particular. You have several different ways to think about problems and several different ways to approach problems.
We have a number of academic faculty as well as private practice faculty. Everyone, regardless of their background and experience, is dedicated to the education of the residents and fellows. It's really unparalleled.
Cedars Sinai happens to be the largest hospital in California. We see patients from all income, socioeconomic levels, races and creeds and national origins.
We have a huge research institution. There are several projects going on at any given time, including VQI projects or just general clinical research, drilling down and getting a better understanding of aspects of vascular disease.
It's a good atmosphere, it's collegial, you're treated respectfully almost as a junior attending or a colleague more than sort of our trainee, which I think also helps the process that coming to work is an enjoyable experience.
We are a big believer in the team model. We look for people who fit our mold in terms of having an upbeat attitude, who are willing to work hard and want to show up at work and have fun every day. And that's what we do.
We have what we call East Coast structure, but West Coast personality. We expect a lot out of our fellows. They're expected to work very hard, but we also live near the beaches, and we also live in Southern California, and there's a lot of great lifestyle aspects to living here.
Cedars is definitely top-notch. It's a world-class institution, a true hybrid academic and private community model with some of the top vascular surgery attendings training you. It's really, truly the total package.